vitals. Mr. Wilson, can you hear me? Still have a pulse. We have no pulse. He's unresponsive. Guys, we need help.
Interprofessional communication is extremely important. Just having the ability to understand what everyone's role is allows you to think one step ahead, to think, how may I be able to help this person do their next job?
Shall we start recording? Jordan, I need you to do the defibrillator. Okay. Justin, can you do meds?
I can.
Okay. Team leader is the person who's responsible for identifying the roles and really coordinating the code. So if you don't have a very organized team leader, then the code won't be organized and you have a patient safety risk. So it's a challenge because you have to know what you're doing and be able to think on your feet. So if something's happening with the patient, you can react quickly to get the best outcomes.
We are charged. Everybody clear? I'm clear, you're clear. Is the oxygen clear? When working the defibrillator, it's definitely important to have great communication because, like you said, you don't want anybody to be unnecessarily shocked because that can be dangerous for not only the patient, it can be dangerous for the team as well.
Almost 100 students through these simulations in one day, and every student had an active role in the simulation. So the fact that they were able to be flexible with our schedule and provide students to come in and be in the scenario with us really made the difference. The literature proves and the IOM supports that we need to have more interprofessional activities to improve patient safety.
Being an occupational therapy assistant and going through a code scenario like this definitely was a very scary and kind of nerve-wracking process, but you know, as OTAs, we do get trained in CPR before we start our program, so it was really nice to be able to actually put it into practice and get the feeling of how it could be. I mean, we could definitely be in a situation like that, and I think it's important for us as OTAs to experience that situation and know what we can do, what we can improve on to make the quality of the situation better.
I mean, it helps a lot, you know, getting able to communicate with all the different team members and kind of learn the lingo a little bit. I know one big difference as far as us and respiratory and radiology, the word obstruction. Like, to us, we think airway obstruction. You know, we need to clear the airway and stuff like that, whereas with x-ray, a lot of times it's like bowel obstruction or embolism or something like that. So kind of learning kind of like this scenario kind of helps us kind of know what they're talking about and what they're doing and things like that.
I was able to do another simulation, and I did the simulation before I actually saw a code in the clinical setting, and it was so similar that I could see and identify every single thing that was going on, every role.
I feel like these scenarios have definitely made everyone decrease their errors because those are errors that you don't want to perform in the hospital. You don't want to make I mean, it's inevitable to make mistakes, but making them more so in simulation rather than in the hospital is definitely key for patient safety and for your team's safety.
To have the opportunity to have such a nice facility here at USI. This year it's a lot nicer because we have the rooms back here, as you can see, that are fully decked out and allow us to do everything that we would do in a normal hospital setting. The past experiences, they've all been really good, but this one just allows for it to be a little much more realistic, and that gives you much of an advantage going into the actual hospital setting.
With team steps, it was important that everybody knows their clearly defined roles and are able to, with everybody having knowledge of each other's roles, it makes everyone able to help each other out and know what is expected of each team member.
Sometimes in simulation, students, we run this simulation with a few students and then the rest of the class observes. We decided to make the leap and provide an experience for every student that they would have an active role. And I think it really made a big difference. And I think one of the greatest things that came out of it was the students feeling that sense of accomplishment because they were flawless.
I feel we definitely are at the forefront of, you know, all the changes happening in healthcare. where we're in an environment where we're expected to do more with less, by relying on our different team members and knowing their different roles can actually help us to do our job more efficiently and effectively in the end.